You're welcome back to Morning Express. Now let's turn our attention to the health sector. November 1st, we hear that the Nigerian Association of Resident Doctors, NARD, is set to embark on an indefinite strike if the federal government fails to meet its demands. Now, this is going to cripple the health sector as we know it. Joining us in the studio this morning is the second vice president of the Nigerian Association of Resident Doctors, Dr. Kwarshak Kevin, speaking to us right now. A very good morning to you, Dr. Kevin.
Good
Thank you
morning.
so much for availing yourself for this discussion.
Thank you so much. Good morning. Good morning, our viewers.
The concept or idea of a strike is not new to Nigerians, most especially when it comes to the education sector or the oil and gas sector, or when it pertains to health. When Nigerians hear that doctors are embarking on a strike or nurses are embarking on a strike, it raises a lot of concern. Why is NARD going on the strike?
Well, thank you so much for the opportunity to actually talk on your television program. First, let me send in the greetings of my president and then the entire resident doctors of well over 10,000 from Nigeria. Yeah. Having said that, it's good that we talk about things like this. I'm happy you mentioned something, that strike is not new to us, but there are some certain sectors that once you talk about strike, then you should raise a lot of concerns. Yeah. And health is one of those sectors. I think next you should be talking about security, right? Now, if there is any problem in this country at all, whether you as a TV anchor or the chief of staff in this country or the president, the first person to be called upon is a doctor. Because without health, without life, you can't do anything, right? Now, this is a sector that has, I would say, without any mixing word, has been neglected for some time. The resident doctors, let me just give you a little context of where we're coming from. Okay. And I like giving this analogy because my president have given these statistics, and I think we've made a good very research, and I also want to cut it here. Okay. Sometimes in 2014, when the then Minister of Health, NAT went on strike at that time, and all the resident doctors were sacked, based on the advice given to Goodluck Jonathan at the time. At that time, were about 25,000 in the tertiary institution.
And all of them were sacked?
All of us. All of.
Including you?
Yeah, of course. Okay. Everybody was given a letter, a termination letter, that you're not needed again. And that's at the tertiary level. At the state institutions, we have about 15,000 or thereabout. Yeah. While at the private private institutions, we have somewhere around 500 to 700 resident doctors. Today, as I speak to you, that's like just a decade away from that time, right? Yeah. We're having doctors of just around 10,000 in the federal institution. Just around that.
Down from 24,000.
Exactly.
Why?
Exactly. That's the question we should be asking ourselves. Why? The question is because there are a lot of concerns by doctors, particularly the resident doctors, which I forgot to mention, that doctors, the resident doctors, seem to be the larger group of doctors in Nigeria. If you go to any tertiary institution, the major workforce in that institution is the resident doctors. Yeah. All right? Now, doctors have to leave. The issue of JAPA, immigration, and all of that, it has not been new to anybody. Okay. And why do doctors leave Nigeria? And that's where we're going to, and that's the problem. Okay? Now, you see, this issue of strike is not just about money. I've heard some of your colleagues in the media saying, oh, doctors are going on strike for money. No, it's not just because of money. Yes, money is one of it, but I will categorize our problems into two. Okay? What I will tag it as remuneration problems with government and the establishment problems. Yeah. Now, when you're talking about the remuneration problem, let me tell you, in 2014, all right, there was a circular about doctors being, our salary was increased by 35%, something just very small, just to account for inflation and all of that. And the implementation didn't come early. It came 7 months later, yeah, after the circular came out. And government said they were going to pay arrears. Since then, till this very moment that I've been speaking to you, these monies have not been fully paid. Sometimes in August, our parent body took it upon themselves and said, okay, we're going on strike. Government said, no, don't worry, we're going to pay this money. They said, we assure you we'll pay the entire 7 months. Unfortunately for us, the government paid only 2 months. We never saw the remaining 5 months. This week, when we're about to start this strike, they call us and say, okay, we're going to pay. They say we're going to start the payment. As I speak to you yesterday, 1 month was paid.
Out of 5.
Out of the remaining 5 months, just 1 month was paid. So where are we going to? So
was this payment made to pacify NARD to not embark on the strike?
I would think so.
Or is it that the federal government, via the Ministry of Health,
yes,
is just doing that as a means of perhaps making one payment per month, clearing off one arrears?
I don't want to believe so.
Is this an information that has been passed down to you?
My own understanding is that they say they were going to clear the remaining outstanding 5 months so that the strike will be averted.
At once?
At once. That was the agreement.
But they failed to do
Yes, they failed to do that. Even the 1 month I'm talking about that was paid yesterday, not everybody got. I'm done speaking to you here, I haven't gotten mine. That's the truth. If you called many resident doctors, they will tell you that they haven't gotten theirs. All right? So the payment of even the 1 month is partially done. It hasn't been fully done. But that's another issue.
Okay.
Let me take you to another one.
Right.
We have this issue of accoutrement allowance. Accoutrement allowance simply means just a stipend that they gave us, just 100,000 per year to change your uniforms, to change your scrubs and all of that. Have you asked yourself how much are they paying senators or House of Reps to change their wardrobes and all of that? But for a doctor, you're paid only 100,000 per year. And do you know when this thing started? Just 2023. All this time, no doctor has ever gotten 1 kobo to change his uniform.
Has that payment been
consistent? That's the problem. It hasn't. In 2023, that was approved. They said CEOs of tertiary institutions should pay. Yeah. And through some agitation, some institutions paid. Some till today, they haven't paid. Now, in 2024, they said government was going to pay the first 6 months, while the other institutions now pay the remaining 6 months. Till this very moment that I speak to you, that money has not been paid. What is 50,000 naira to government? So these monies we're talking about is obviously nothing much.
50 or 100,000?
It's 100,000 per annum.
Per annum?
Yeah, 100,000 naira per annum. It hasn't been paid for that 2023, okay? Yes. And there is something we call specialist allowance. When you are, once you are being trained, you are being trained to become a specialist, a consultant, right? A fellow, then you'll be appointed as a consultant. Now, there was an agreement. There was an agreement. There was a circular that senior residents should be paid this specialist allowance. Somehow along the line, some people somewhere sat somewhere and decided that these doctors are not entitled to this specialist allowance.
How much is the specialist allowance?
It depends. It depends on your rank.
Give me a range.
It probably just a range of like 100,000 or thereabouts.
100,000 naira range for the specialist allowance.
Specialist allowance.
100,000 naira range for the what's the
accoutrement? No, for accoutrement it's an absolute figure.
An absolute.
It's an absolute figure for yes.
Okay.
So if you divide that per month, it means you're just
these 2 allowances in addition to the salary.
Yet
the payments have been inconsistent.
It's not even inconsistent. For the specialist allowance, it hasn't been paid. It has just been paid for a few minutes, for a few time, and then it was now stopped. All right. Now, if you check our payslip, as some of the senior resident doctors, you discover that the element for specialist allowance is there, but no money has ever been credited to that element. The evidence are there for everybody to verify this. You are a journalist, just ask and I will show you. That has not been done. We've been asking them. Now, to even tell you, for the past 10 years, doctors have been shortchanged. There's what we call the corrected table for our allowances. All right? That we've asked the Salary and Wages Income Commission to release. Till today, this thing has not come out. And for the past 10 years, we've been shortchanged. We don't know our actual salary. And what we receive is not actual, it's not supposed to be the actual salary that we're supposed to earn. Because the corrected table has not been out. We've asked the government, release it. Let's pick it up from there and agree on, okay, this is our allowances. What do we actually do from this point? But till this very moment, that has not been done.
Dr. Kevin, there seems to be a lot of issues on the table.
Yes.
From the issue of remuneration to the issue of allowances being diverted or not being paid. Or, they start payment and then they stop. Have you tabled all of this? Has NARD tabled all of this to the Ministry of Health, to the federal government as part of maybe a meeting or a consensus to meet with people at the helm of affairs to trash these issues out?
Definitely. I will come to that.
Okay.
Let me just try and tell you something. You know, when I was giving statistics, I made reference to tertiary institutions and state institutions, right? Now there are some state institutions as part of the remuneration that have failed to pay their doctors. I give you an example. Benue State University. Governor Alia, who is a reverend father, has refused to pay his doctors money. Over 18 months.
Who work in the Benue
Who work in the Benue State University. I'm saying this. He is a reverend father. He's a governor. He has refused to pay his doctors for 18 months. He hasn't given any explanation. The state institution has gone on strike severally, to press these demands, yet nothing has been done. If you go to FMC Owo, it's still a similar problem. Doctors have been owed money for a long time. If you go to Ife, it's the same issue. They've been owed for it. So why are we still talking about this issue? What does it take to solve this problem?
How much strain is this putting on the backs of resident doctors that are now remaining in the country? You mentioned a drastic drop from 24,000 in about 10 years ago.
About 10 years ago, yeah.
To about 10,000 now.
Yes.
And if you take a look at the statistics from 10 years ago up until now, the population of the country has increased to a certain extent. There is more, there are more people, and there is more demand, for more doctors. But it appears that we are short of about 14 or 15,000 doctors due to some of these irregularities. How much strain is this putting on your back?
So much strain. So much. Let me give you a statistics. Based on WHO, the recommended doctor to patient ratio is just 1 to about 600, at least for we in the developing countries, right? As it stands now, in Nigeria, I'll give you a statistic of just around 10,000 or 11,000 resident doctors as we speak, doctors now, all right? So it means that one doctor is to a ratio of about 10,000 patients. Okay? If the work you've been doing 10 years ago, if 10 of you were doing this work, today, only 2 of you are doing this work, if not 1. Now, that takes me to some of the establishment issues that I was telling you about. Early this year, we lost a resident doctor in Rivers State University who took a call for over 72 hours uninterrupted.
3 days.
3 days. He went to his call room just to take a nap, and that was it. The guy died. Stress. In Lagos, in Lut, it was the same problem in 2023. We lost a house officer in Lut. Why? Because in Nigeria, currently, right, a resident doctor works for over 106 hours for those who are in the faculty of physicians. For surgeons, they work well over 122 hours per week. If you divide that, all right, it means that a resident doctor in surgery takes well over 5 days uninterrupted work or call. He works from Monday, let's say, through Friday without going home. That's what I mean.
In the office.
Of course. You have to work, because our work is so that when you work today, you start call from 8 a.m. To another 8 a.m., right? Then the work starts that 8 a.m. You start working, then you're on call on that day. So it continues in that cycle.
For an entire week at a stretch.
Yes, of course. I won't mention his name. One of our colleagues, who happens to be our ESCO now, he's part of the National Officers Council, right? He was doing a posting somewhere here in Abuja. And when he came for that posting, for like over 3 months, he was the only doctor in that unit. One day he collapsed. He was in the ICU for 3 weeks, unconscious.
Due to stress.
Yes.
And the strain of working consistently
of course.
For that long.
He died, so he almost died. When eventually he recuperated from the illness and all of that, they still asked him to come back and complete his postings. That's how bad it is. And that's why we as resident doctors say, no, enough is enough. How much lives do we need to lose again? And we have put a cap now. We said, effective 1st October, right? All doctors will not take more than 24 hours call.
I was going to come to that in a moment, Dr. Kevin. You have laid out the complaints. You have mentioned issue of remuneration. You've mentioned issue of the low number of doctors available in the country. Doctors working long number of hours, collapsing, some dying, some being unconscious and in the ICU. These issues are numerous. What solutions do you want? What are your demands to the federal government as NARD?
We've asked
one after the other. I want you to lay them out.
We've asked the government to do the needful. You asked a question previously that have we tabled this into government? Yes, we have. the past two presidents of NARD, right, have consistently issued out ultimatum. In fact, let me say ultimata. We've virtually become like an association of ultimata at some point, because we kept issuing to government, do something about this problem. Nothing has been done. Now, we came into office just barely a month ago. And then the National Executive Council at that AGM, which is the highest decision-making body of the association, decided that no, we need to take a decision. We wrote to the government and we said, in addition to all the things I've mentioned, right, there is a very disturbing trend in some hospitals where, despite the low volume of doctors in this country, all right, despite this trend we're going through, doctors are being sacked. In FTH Lokoja, for instance, somebody somewhere just sat.
What is the cause for the sack?
Exactly, that's the problem. You know, so that what happened was that these are union leaders. Dr. Jimo, for instance, was a president, a sitting president of the association. Okay, Jimo was agitating for the welfare of his members. There was no call food. Call food, sometimes if you get it very poor, you know, there was no call room. There were a lot of issues. There were few. In fact, the consultants were even more than the residents in the hospital. And he said, no, let's do something about it. Let's improve the welfare of our people. Unfortunately, some people didn't find it that easy, and they decided to just go and, brought up a lot of issues and then sack Dr. Jimo. And no, that after that, you know, it kept happening until they sacked about 5 doctors in that hospital. There is one Dr. Yomi in that hospital who is from the orthopedic department in that same hospital, just to buttress why Jimo was agitating. That guy is taking call for this month of October for good 30 days. Every day of that month he's on call.
In the hospital?
In that hospital. And this was
showering and
of course. Do you even have the opportunity to shower? Do you? Sometimes you have to even live on snacks and drinks. Do you even have time to go and eat? It was a problem. And Jimo said, no, we need to do something about this. That was his crime. And other people who supported him came to say, okay, no, you don't need to sack him. This MD now said, you all have to go. And we said, no, these people, they are our members. We can't watch, we can't sit back and then somebody will just come and sack them. They just have to return them back to work. They have to return them back to work.
Pressure mounted.
Of course. And let me tell you, there's something again that is happening around that in that hospital and many other hospitals. Casualization of doctors. Despite the fact that I told you we have very few doctors in this country, some CEOs are bent on employing doctors based on local. What that means is that every 1 month or 2 months, you have to go and apply and sign that you're looking for a job. And
wait, hold on. I want you to rephrase this.
Okay, so there's what we call casualization of doctors in some of these teaching hospitals or some of these tertiary institutions. You know, as a doctor, when I come in for residency, right, you employ me, you give me an appointment letter until I'm through with my program. Now in some institutions, they now say, okay, we need locum doctors. It's not out of place to have locum doctors. It's okay to have locum doctors, right? But the idea is that when you have locum doctors, it means you haven't gotten waiver from federal government to do employment where those people will actually be captured under IPPIS. That is the idea. Now, some of these CEOs felt that that's the best way for them.
So even though they have the option of regularizing it and ensuring that the doctors are captured under IPPIS, they don't.
They don't. That is the problem. We have some of our colleagues who have been locum doctors for 5 years, 3 years.
So every month
they go to reapply.
And the hospital reserves the right to either accept or let them go.
Of course, as locum, I can decide to fire you today. As I'm speaking to you, I say you're a locum doctor, leave, and you go. That is it. That was what happened. That's the argument of the CMD or the MD, you know, as regards to Jimo and others.
So there is need for such reforms. You were going to list out, you mentioned something about coming from November 1st, no resident doctor in the country should work for a certain number of hours.
October 1st.
October 1st.
October 1st. Okay. So we said that doctors should not, you know, in any way take more than 24 hours continuous call. It's for your own good as a patient if you're coming in. It's for my own good as a doctor. You know, a doctor that is not healthy, a doctor that is not in a very good state of mind, is a dangerous doctor. It's a very dangerous doctor, and it's at risk to everybody. What is happening currently in this country as regards the health sector is an emergency. It's a national emergency. It's a national emergency. So we say doctors should avoid that. When you take 24 hours, go and rest. If you must take the 24 hours, then it should be paid. That's what is being practiced in all parts of the country. If you go to the UK, for instance, now, if you work, you can't work for more than 24 hours. If you do, they'll flag off your account. You need to come and answer questions why you have to work for more than 24 hours. Or your supervisor will have to give explanation as to why you have to stay for more than 24 hours. In some instances where you will just have to, probably due to some shortage of manpower, at that time, you'll be paid for extra hours. And that is what we're asking for. The current Minister of Health, Professor Ali Pate, has worked in the US for a very long time. And he knows what system works best. He knows. He knows what is the best international practice.
Why are we not adopting?
So exactly. So why are we not replicating what he has seen there, what he has been practicing? Why is our case different? So we say enough is enough. Okay. So you see, there are a variety of issues, many issues that we have tabled before the government. There are some of our junior colleagues called house officers. I'm sure you know about them. They are the newly inducted doctors, who just came into this thing. Over years, I did my house job in 2013, in 2013, right? Yeah. At that time, when you're doing your house job, somehow you have your pension. Today, that's not the case. These guys have been stylishly taken out of the civil service progression. Okay. And they've now been taken, I don't know what they're doing, they've not taken them completely out there. Now, as a house officer, you don't even know how much is your money. You don't even know, whatever you see in your account, that is, you don't have a pay slip. To know, okay, maybe probably my money was short by 50,000 naira. This is where the money went to. These things are not there. And we've told the government, please take them back to the civil service. We will not continue that. You just have to do that. There is something very key, what we call a collective bargaining agreement, CBA. That is just an idea, to review the salaries of doctors or remuneration of doctors every, like a decade. The last time it was done, I think it was around 2014 or thereabout. It's due, okay? Yeah. Around August, there were a series of meetings, there were agitations here and there, and government agreed to set up a meeting, with all these relevant stakeholders so that this issue should be resolved. As I speak to you, the entire process has been frustrated by some few individuals. And we don't even know where we are. We're just there. And for how long?
Now, Dr. Kevin, let's take a look at it from, it's important that you have laid out these points. It's important that NARD is sending its demands home to the federal government. But let's also talk about the people, Nigerians who are desperately in need of the services of people like you and others in NARD. Where does that leave them?
Okay, thank you. You see, doctors are humans. If you ask me today, do I really want to go on this strike? No. If everything is addressed today, I can assure you I want to remain at work. You know why? Because for many of us who have the opportunity to leave this country, virtually all the 10,000 doctors I'm telling you about, today they all have the opportunity to leave this country. And
but they choose not.
They choose not. They are patriots. They are heroes. But for some reasons, they stay back. So, of course, if despite this harsh working environment, these guys have stayed back to work, do you think these are the group of people that really want to go on strike? No. But we've been pushed. We've been pushed. We've been loyal. We've been listening. We've approached the table several times, but it seems no one is listening. No one is listening. Sadly, just yesterday, I'm hearing some narratives everywhere where they're saying the president seems to be a militant. He's having a militant approach and all of that, And I said, it's not just about the president. He just have to do the needful. He just have to do the needful.
Because the people saddle with the responsibility. The minister, the Minister of Health, talking about Professor Ali Pate,
exactly.
Minister of State for Health as well, should take responsibility for that.
They should. And I must use this opportunity to say, anyway, the State Minister of Health have met with us like once where we sat down and talked about some issues. So I can see he's making effort, but the effort is not good enough. That's the point. Now the patients, about the patients, right? We are all stakeholders. There is something in global health, for instance, where they will tell you when you want to solve a problem of health, you have to bring all the relevant stakeholders. And these stakeholders cut across different disciplines, from the media to the politicians to public opinion leaders and all of that, right? Now, where are they in the whole scheme of this discussion? It all appears like it's only doctor that is speaking for himself. Nobody is thinking about the danger of doctor going on strike.
Well, that is why we are here.
And that's what I'm trying to say, that, so for now, at least you media are playing your role, but I want you to also go a step further, okay? Just having us on TV is not enough. I wanted to also have some of these government officials.
Come in.
Of course, we're ready to actually join them in the discussion.
We will arrange some sort of meeting between perhaps you or any member of
or even my president.
or even
Come
the
here,
president
exactly.
and a representative from the Ministry of Health.
Let them
to speak about this.
Let's talk about, because you see, all the stakeholders have to be on there for this problem to be solved. Issue of health is a national disaster. Yeah. Whether we like it or not, and all the people watching from afar, and they are not putting pressure on this government to do the needful, will all be victims of this strike. And like I said, we don't want to go on this strike, but with all these apologies, and the sympathy or empathy we have for patients, there's nothing we can do at this point. We're helpless.
All right, Dr. Kwarshak, we must thank you so much. It's been wonderful having this discussion. I wish we had more time to talk, but we will have you back in the studio. Hopefully to speak about the outcome of this strike action, if it will hold come November 1st.
Did you say it will hold?
If it will
just
hold.
Give me 30 seconds. Let me just say this.
All right.
You see this strike? Yeah. This strike is holding. Our demands are 19, and there is no minimum demands. The minimum demands is 19.
19.
The 19 are the minimum demands. Now, this strike is unlike other strikes in the past. The strike in the past is such that probably the National Executive Council and then the NOC and extended NOC will meet and review issues and say, okay, let's go this way, right? Yeah. This time around, the approach is from bottom to top. I've never seen democracy being practiced like it's being practiced by this current president, Dr. Suleiman Mohammed. So he decided to give the power back to the people. And people decided. All the congresses in the entire country, the entire doctors met at their different centers, and then they voted, discussed all the 19 items, and they voted based on items. And all the centers have voted for strike. So what that means is that even as a president, you don't have the right to call off the strike without the Congress. So this will be one in a very long time. This strike is a mother of all strikes, and this strike is going to hold. All right, Dr. Kwarshak, thank you so much. Thank you so much. That has been Dr. Kwarshak Kevin, who is the second vice president, Nigerian Association of Resident Doctors, laying the complaints of NARD about some unmet demands on the part of the federal government and why this strike is necessary, and as he described it, the mother of all strikes in the health sector. We'll take a break. When we come back, we'll turn our attention to land matters in the country. Do well to stay with us for the last leg of discussion on Morning Express.